Hello everyone, welcome back to the GDC English classes. Good evening to all of you. How are you all? How are you guys? How are you? Farmer Naresh, good evening. Chahan Vinod Singh, good evening. Farmer Naresh again, good evening. Okay. How are you guys? Give me a thumbs up if I'm audible, visible properly. Give me a thumbs up. Give me a thumbs up if I'm audible, visible properly. Yep. Anyone? Am I audible, guys? Please confirm me first. Good evening, Swarnalata. Okay, Swarnalata. Mansi Patel, okay. And Chauhan Vinod Singh. Okay. All right. So have you? Good evening, sir. Surface, क्या लिखा? Very good evening, sir. Suffering from डर. अरे किस बात का डर है? किस बात का डर है, सर? दीपक कुमार, किस बात का डर है आपको? Why you are feared? Hmm. Audio clear? Okay. So, how many of you have seen the GPAT? How many of you are there who also given the GPAT examination? How many of you have given the GPAT examination? How many of you are present over here? Now, guys, start class. I will start soon. Don't worry, Naresh Kumar. Let me talk to you guys first. How many of you have given? Good evening, Saxena ji. Okay. So, how many of you has given the GPAT examination? Today, answer key has released. Have you seen your marks, guys? Have you seen your marks? Anybody is here who has given the GPAT examination? Anybody? Yes? No? Tell me. Good evening, Varun. Varun Dhawan. Okay. So, Vijay, how much marks you got? Vijay, how much marks you got, guys? Tell me in the comment section how much marks you got. Mm-hmm. Naresh Kumar. Okay. No worries. Kyra Shivin. Okay, Kyra, how much marks you got? How much marks you got? 160 only. Okay. Category, Vijay. Vijay category. Kyra, good evening. Naresh, which zone? Okay. Kyra, how much marks you got, guys? Chalo, tell me so that I can start now. 341. 341. Very nice. Seems to be topper, no? 341. That's a huge number. That's a huge. इसमें तो दो लोग क्वालिफाई कर जाएंगे. इसमें two people will qualify. Congrats. OBC NCL. Okay. 160. Then still a chance over there. Hope for the best, Vijay. Okay, chalo guys. Let's start with this one and have Guwahati नरेश कुमार. Okay. चलो. पहले कहाँ से हो तुम लोग, नरेश कहाँ से हो आप? फिलहाल चलो this one. Which of the following are strongly deactivating group? Okay, I have to also keep this thing towards my eye. Which of the following are strongly deactivating group for electrophilic aromatic substitution reaction? Okay, deactivating group, guys, for electrophilic aromatic substitution reaction. Fluorine, chlorine, amine, hydroxy group, or you can say alcohol group, nitro group, or CF3 group, OCS3 or C6H5. Which one is the strongly deactivating group, I'm asking? Any bids for deactivating group? Any bids? Deactivating group leads towards the meta direction, right? Leads towards the meta direction. Hana? And the activating group leads towards which substitution reaction? Yep. Anyone? Mansi Patel says D. Anyone, guys? Swarnlata says B. Okay. And Prathamesh Kuchakar says B. Uh-huh. The answer is C, to be precise. Ankush Pangotra. That's nice. Hana? Ankush Pangotra says C. That is what the right answer it is. Moderately activating, weakly activating. Orthopara, right? Whereas if I talk about meta director, these are moderately deactivating, strongly deactivating, weakly deactivating. These are your meta directors. Okay, so you have to learn this one, electrophilic aromatic substitution. Okay, chalo. Now, the compound obtained by heating a mixture of primary amine and chloroform with alcoholic potassium hydroxide. Okay, this seems to be familiar, right? The compound obtained by heating a mixture of primary amine and chloroform with alcoholic potassium hydroxide. Which one is it? Simple, it seems. Simple, it seems. Yeah, that is. That's your. Anyone? Anyone, guys? That's a carbylamine reaction, if you remember. Carbylamine reaction mein alkyl isocyanides are being produced, right? Alkyl isocyanide, NC. These are your carbylamine reaction. Here you can see carbylamine, the method of preparation for the alkyl amines. Alkyl amines, method of preparation for alkyl amines. Calculate the number of optical isomerism in this one, in this following compound. CH3CHOHCOH, optical isomerism. Optical isomerism, 2 to the power n, right? 2 to the power n, and n is your chiral center. N is your chiral center, right? So here you can see there is only one chiral center, right? So 2 to the power 1, that is what? 2 itself. And here you have got the answer, right? 2 is your correct answer. Now, hydrogen peroxide acts by which mechanism? Protein precipitation, halogenation mechanism, oxidation mechanism, or redox mechanism? Which one is it, guys? Hydrogen peroxide acts by which mechanism? Protein precipitation, halogenation mechanism, oxidation mechanism, or redox mechanism? Simple. Hydrogen peroxide, it is what? Oxidizing agent, right? It is what? Oxidizing agent, right? So obviously that's going to be your oxidation mechanism only, right? Priyesh Singh, very good, right? Chalo. Which of the following is used as a mouthwash except, okay, except they are asking zinc sulfate, zinc chloride, ammonium silver nitrate, or magnesium peroxide? Which one is it? Which one per which one is it, guys? Which of the following is known as the is also used as the mouthwash except zinc sulfate? Sulfates are being used. Chloride are being used. Silver nitrate, yes, are being used. But peroxide, magnesium peroxide, these are not being used as mouthwash, right? Chalo. The limit test for arsenic heavy metal is done by using test tube, Kunzit apparatus, separate funnel, or Kipps apparatus. That's what? Which is correct? Which one is correct? That's your Gutzit apparatus, right? Everybody knows about this one. And this is what the GPAT 2026, they have a 6.5 millimeter ka internal diameter. Okay, glass tube. okay, inner diameter, and 18 millimeter का outer diameter. Okay, this is you have to remember. Prazepam, oxazepam, clonazepam are structurally similar and have the system. Which one? 5H dibenzazepine, 1,2,4 benzothiazine, benzodiazepine, or phenothiazine? Which one is it? Yeah, which one is it? Obviously, it's going to be your benzodiazepine, right? But what is the antidote? What is the antidote of benzodiazepine poisoning, guys? Antidote of benzodiazepine poisoning. Can anyone tell me? What is the antidote of benzodiazepine poisoning? Anyone? Antidote of benzodiazepine poisoning? Yeah? Chalo, do let me know in the comment section. Chlorpromazine is an antipsychotic drug possessing butyrophenone, thioxanthine, phenothiazine, or acridine. Flumazanil, very good. Ayush Raj, Priyesh Singh, Ankush, very good. Manju, Kanna. Okay, flumazanil, that's right, very good. Very good. And flumazanil is what? Competitive inhibitor at GABA A site, right? Okay, now this one. Chlorpromazine is an antipsychotic drug possessing butyrophenone, thioxanthine, phenothiazine, or acridine. Simple, simple, है ना? Pheno तो ठीक, but what about that? So pheno means what? Thiazine, right? Simple, phenothiazines. Okay, chalo. Which of the following is a hydrophilic organophosphate compound? Hydrophilic means water soluble. Water soluble. So parathion, malathion, or ecothiophate. Which one is it? Which one is it, guys? Which of the following is a hydrophilic organophosphate compound? Parathion, malathion, or ecothiophate? Hmm? Simple. Parathion and malathion and combinedly known as, these are your what? Insecticides? Insecticides. And ecothiophate is the only drug which has been useful in glaucoma, right? Glaucoma, it has been useful over there, right? Ecothiophate. Chalo, the principle of separation in thin layer chromatography is adsorption, partition, both A and B, or none of the above. Which one is it? Which one is it? Acha, what kind of material? Which material is being used in adsorption? Which material is being used in absorption, guys? Anyone? Which material is useful in adsorption? Hmm? Thin layer chromatography. Thin layer chromatography, both A and B, guys. Thin layer chromatography. Silica gel G is being used as a adsorption. Partition में obviously water will be partition, है ना? तो both are the things that is being present, both A and B, right? Chalo, very good. Adsorption TLC and partition LLC, TLC, right? Chalo. Now 0.5 molar H2SO4 is diluted from 1 liter to 10 liters. Normality of the resulting solution is. Chalo, this one 0.5 molar 0.5 molar is diluted from 1 liter to 10 liters. 1 liter to 10 liters. Then N1 should be, you would have know about this one. N1 V1 is equal to N2 V2. Now solve. Now solve. Which one is the correct one? N1 you have to find out. V1 is given. V1 is given. That's your 10, and N2 should be your 1 and 0.5, right? Then N1 is equals to 1 into 0.5 divided by 10, right? That should be the answer. है ना? तो 0.05. 0.1 is going to be the correct answer. Okay. H2SO4 है ना? I think H2SO4 है तो 2 से multiply भी तो होगा. Okay, basicity of the thing. So 2 is to 0.5 तो 1. It will become 1 over the n, then 1 into 1 divided by 10 is equal to 0.1 normal, right? So Oswald dilution is applicable in the case of the solution of Oswald dilution, NaCl, NaOH, H2SO4 or CH3COH. Which one is it? Which one is it, guys? Oswald dilution is applicable in the case of solution. Yeah, ये तो you can answer. This one you can answer. Oswald dilution law, that is present mainly onto the weak acids or weak base. So which one is weak? Vikas Kumar, hi. NaCl is a salt, so it doesn't have. NaOH strong base, H2SO4 strong acid, CH3COH weak one. So that is considered to be acting onto this one, right? CH3COH. Okay, chalo. Weak electrolytes, dissociation constant of the weak electrolytes. Okay, chalo. The chemical name of thiamine would be thiamine. 2-oxy-4-aminopyrimidine, 2,4-dioxy-5-methylpyrimidine, 2,4-dioxypyrimidine. Yeah, which one? Which one is it? That's going to be 2,4-dioxy-5-methylpyrimidine. Okay, thiamine. Now, all are essential amino acid except leucine, lysine, phenylalanine, or tyrosine. Which one is it, guys? All are essential amino acid except leucine, lysine, phenylalanine, or tyrosine. Essential means that should be taken with diet, right? That should be taken with diet. But except is written. Oswald dilution is generally used to determine the weak electrolytes. Ayush Raj, okay? It is generally being considered for the weak electrolytes, weak acids and weak bases. Okay, so here is your tyrosine, right? Chalo. So here is the one, VIP hall for MTT and cat pass GGG. Okay, cat pass GGG. Chalo. Histones are what? Acidic chromosomal proteins, basic proteins associated with RNA and DNA. Acidic polysome proteins, basic proteins associated with DNA. Which one is it? Histones. Histones? That's your Ravi Balvan says D, right? Basic proteins associated with the DNA. That is going to be the correct answer, right? Chalo. Now, when an iron nail gets rusted, iron oxide is formed without any change in the weight of the nail, with increase in the weight of the nail, ये तो सेम हो गया. अच्छा, डिक्रीज है यहाँ इंक्रीज. ओके, without any change in color or weight of the nail. Which one is it? Which one is it, guys? Obviously, if what happens if there is a nail get rusted? Rusted means iron deposition, right? Iron deposition, rusting takes place, and what will happen? Rusting takes place, so obviously the weight will increase, right? Weight will increase, obviously. Okay, chalo. On which day the World Environment Day is celebrated? On which day the World Environment Day is celebrated, guys? That is so simple. That is simple. Vikas Kumar says C. Pansi Patel says C. Swarnalata says D. Chalo. Which one is it? On which day the Environment Day is celebrated? 5th April, 15th May, 5th June, 25th April. TT Hall में VIP. That's right, Ravi Bulwan. Which one is it, guys? On which day the World Environment Day is celebrated? Yeah, that is your 5th June, right? Chalo, very good. CNG stands for, बड़ी कमी है भाई इसकी आजकल. नहीं, LPG की कमी है, सॉरी, CNG की नहीं, LPG की कमी है. CNG stands for common neutral gas. मैंने भी फॉर्म भरा है सर, नंबर फार्मा, नो फार्मा में कोई मिनिमम रिक्वायरमेंट है क्या सर? सिर्फ फार्मा करके आओ तो काफ़ी हो? हाँ हाँ, लेकिन सारे सही होने चाहिए उसके लिए, क्योंकि 70 क्वेश्चंस हैं और ज़्यादातर जगह पे जो कट ऑफ है वो 65-70 ही जाती है। इलाहाबाद रीजन की पिछली बार 65 गई थी, राइट? सो कुछ तो सही करने पड़ेंगे नॉन फार्मा में, तभी काम चलेगा, नहीं तो 0.3 नेगेटिव मार्किंग है 1/3, तो दैट विल सफर। दैट इज ऑब्वियसली गोइंग टू बी कंप्रेस्ड नेचुरल गैस, राइट? और हुसिंग बी न्याउ सुपरकर, न्यानु न्यानु सुपरकर, ना ना ना, न्यानु सुपरकर, हाउ बी कंप्रेस्ड नेशनल गैस? नहीं नहीं। चलो, व्हाट इज द एंगल बिटवीन H2O मॉलिक्यूल, H2O मॉलिक्यूल, H2O मॉलिक्यूल? 90 डिग्री, 180 डिग्री, 122 डिग्री और 104.5 डिग्री? विच वन इज इट? व्हाट इज द बॉन्ड एंगल बिटवीन H2O मॉलिक्यूल? 90 डिग्री, 180 डिग्री, 122 डिग्री, वन। इलाहाबाद से भर की गलती तो नहीं कर इलाहाबाद से बहुत लोग भरते हैं। कहाँ से हो आयुष? व्हाट इज द एंगल बिटवीन, दैट इज योर व्हाट, 90 डिग्री? नहीं रघुवेंद्र, no, it's D 104.5 degree. Here you can see na, here you can see the bond angle is 10.45 degree. It is angle between the orbitals containing electron pair, right? Chalo, the noble gas used in the treatment of the cancer, helium, argon, radon or krypton, which one is being used in the treatment of cancer? इलाहाबाद से ही हो? क्या बात है, अभिषेक सर के घर से ही हो, इसका मतलब है वहां से ही, इलाहाबाद से ही। चलो ठीक है। मैं लखनऊ से हूँ, 140 किलोमीटर दूर है। 100 नहीं, 140, हाँ ऐसे ही कुछ है, 180-200 के आसपास होगा इलाहाबाद लखनऊ। ओके, द नोबल gas used in the treatment for cancer is helium, argon, radon or krypton? That's your radon, okay? चलो, हैदराबाद से भरना था पर सिर्फ ओबीसी का पोस्ट था, इसलिए बैंगलोर से भरा मैं, कंपटीशन कम है। अच्छा, होपफुली देन, होप फॉर द बेस्ट। लेकिन मैंगलोर कन्नड़ सीखना पड़ेगा, वहाँ पे क्वालिफाई हो गया था। चलो फाइन। ऊपर से भाई जनरल की तो हमारी काफी जाती है, क्या होता है। ओके, नाउ इन विच अमंग द फॉलोइंग पार्ट्स ऑफ द एलिमेंट्री कैनाल द रेनिन रेनिन एंजाइम, डबल एन enzyme is secreted? Okay, I'm not talking about this one, I'm not talking about this one, I'm talking about this one, this renin. Okay, stomach, mouth, pancreas or duodenum? आयुष इलाहाबाद मैंने खुद भरा हूँ। अच्छा, दीपक कुमार, दीपक कुमार तुम कहाँ से हो? विच वन इज इट गाइस? दिस वन, stomach, mouth, pancreas or duodenum? Hmm, that's your A, right? Stomach stay you release that one. And if I talk about that renin, if I talk about that renin, which is has a role in ACE है ना, ACE वाला क्या है? That is your RAS system है ना, renin acting under the RAS system. From where does it produced? From where does it produce, guys? Can anyone tell me? मिर्जापुर सोनभद्र से हो? अच्छा, ठीक है, बढ़िया। Okay, potassium permanganate is used for purifying drinking water because it is a sterilizing agent, it dissolves the impurities of water, it is a reducing agent, it is an oxidizing agent. Which one? Kidney. Very good. Which part of the kidney? Which part of the kidney? That's what I'm asking. Kidney तो बच्चा बच्चा knows. JG cells. Right. JG cells. Deepak Kumar and Ayush Raj. Very good. So, potassium permanganate is used for purifying drinking water because it's a sterilizing agent, dissolves the impurities of water, it is a reducing agent or oxidizing agent. Potassium permanganate. Permanganate की बात करी तो that is going to be always the oxidizing agent. Oxidizing agent KMnO4, and KMnO4 की presence में oxidation takes place, so that's an oxidizing agent, right? चलो, the number of moles of solute present in 1 kg of solvent. Quiz side, hi and welcome back to the channel. द नंबर ऑफ मोल्स ऑफ सोल्यूट प्रेजेंट इन 1 kg ऑफ अ सॉल्वेंट इज कॉल्ड एज। चलो ये तो बच्चा बच्चा जानता है, क्लास 11 12th का कॉन्सेप्ट है। दिस इज द कॉन्सेप्ट फॉर क्लास 11 12th, मोलालिटी, मोलारिटी, नॉर्मेलिटी और फॉर्मेलिटी। Which one is it? The number of moles of solute present in 1 kg of a solvent is called as molality, molarity, normality or formality. Which one? 230 आए हैं सर, बेकार लग रहा बहुत। अरे रे रे रे, नो वरीज फैन ऑफ नकुल। 230 आए, अरे स्टिल स्टिल नहीं पर है उसमें फोड़ना। Still you have got a chance. Okay, chalo this one, that is molality, right? And if I talk about the 1 liter of a solvent, if I talk about 1 liter of solvent, then 1 liter of solvent, then no worries, you still have Niper in your hands, right? इसमें क्वालिफाई और अच्छी रैंक भी आ जाएगी 230 में, डोंट वरी, you still have around 500 रैंक के आसपास अंडर ही आ जाएगी, मे बी even you get better as well, okay? So don't worry about that one, don't worry about that one. Chalo this one, if I talk about this one, the number of moles of solute in 1 liter, then then what would be the answer? Then what would be the answer? Then molarity. Very good, very good. अरे आराम से you will qualify, आराम से you will qualify. ज्यादा कट ऑफ नहीं जाएगा, कट ऑफ विल बी मैक्सिमम 200 मे बी, दैट्स इट। चलो, द मोस्ट इलेक्ट्रोनेगेटिव एलिमेंट ऑफ द फॉलोइंग इज, चलो वेरी सिंपल, सोडियम, ब्रोमीन, ऑक्सीजन, ब्रोमीन, फ्लोरीन और ऑक्सीजन। विच वन इज मोस्ट इलेक्ट्रोनेगेटिव? इलेक्ट्रोनेगेटिव मीन्स अपनी तरफ खींचेगा ना, दैट विल अट्रैक्ट द इलेक्ट्रॉन टुवर्ड इटसेल्फ। सर 185 जनरल में चांस है क्या? चांस है तो यार, ईडब्ल्यूएस था, फॉरगॉटन डायरीज। डिड यू हैव योर ईडब्ल्यूएस कैटेगरी? इफ नॉट तो थोड़ा सा ट्रिकी है, बट देर इज अ चांस, देर इज अ चांस 185 जनरल, ओके, देर इज अ चांस, नॉट श्योर श्योर बट हाँ थोड़ा तो चांस है। चलो, दैट्स योर फ्लोरीन, राइट? वेरी गुड, वेरी गुड, वेरी गुड। Nuclear sizes are expressed in a unit named Fermi, angstrom, Newtonium, or Tesla. Fermi, angstrom, Newton, or Tesla. Nuclear sizes. Nuclear sizes. ड्रॉप अगर क्वेश्चंस होंगे तो बन सकते हैं यार, देखो कुछ ना कुछ तो होगा, मार्क्स ऑब्वियसली बढ़ेंगे एंड ऑब्वियसली बढ़ेंगे, तो हो सकता है, दैट्स अ चांस। चलो, नाउ दिस इज गोइंग टू बी योर फर्मी, ओके चलो। एंड फर्मी रिमेंबर कि 10 टू द पावर -15 मीटर, ओके, 1 फेम्टोमीटर। चलो, ओके ये हो गया। हाँ, विच सर्विस वाज adjudged द बेस्ट मार्चिंग कंटिजेंट एज एन रिपब्लिक डे परेड 2026? आर्मी, एयरफोर्स, नेवी और असम रेजिमेंट? आस्था शर्मा सेज, सर 174 आ रहा है जनरल में, क्या करूं? ओहो, होप फॉर द बेस्ट, दैट्स ऑल आई कैन से एट दिस कंडीशन। 174 चांस कम है, होप फॉर द बेस्ट, दैट्स व्हाट आई से, बट 174 में थोड़ा सा चांस कम है, ओके। सो होपफुली, होपफुली क्या पता, गॉड नोज एंड who knows about that one, right? Hope for the best and see you at that time. That's your Indian Navy, guys. Indian Navy has the best contingent over there. Now, who received the Ashok Chakra during the 77th Republic Day 2016 celebration? Ashok Chakra, Captain Vikram Batra, Group Captain Subhanshu Shukla, Squadron Leader Rakesh Sharma, Major Sandeep Umig Krishnan. ओवर अटेम्प्ट कर दी, वहां लालच आ गया था और करने, अरे रे रे रे। चलो दिस वन, अभी रिसेंट की बात है, दिस recent news. Ashok Chakra. Hmm. Anyone has a correlation with NASA? There's a hint now. There's a hint now. अब तो बता दो यार। विक्रम बत्रा को तो बहुत पहले मिल गया, विक्रम बत्रा तो बात ही खत्म हो गई। That's your Captain Subhanshu Shukla, who is from Lucknow itself, right? Subhanshu Shukla. Chalo. Captain of which of the following states is called as Scotland of the East? Scotland of the East. स्विट्जरलैंड की बात करते तो हम बता देते, स्कॉटलैंड की बात कर रहे हैं। चलो, मणिपुर, मेघालय, सिक्किम और असम। स्विट्जरलैंड ऑफ द नॉर्थ की बात करता तो बता लेता मैं। ओके, दिस वन, मणिपुर, मेघालय, सिक्किम और असम। विच वन इज इट? स्कॉटलैंड ऑफ द ईस्ट। ईस्ट 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 मतलब नॉर्थ ईस्ट। सो मणिपुर, मेघालय, सिक्किम और असम, दैट इज योर मेघालय गाइस। ओके, चलो, इंदिरा गांधी सुपर थर्मल पावर प्रोजेक्ट इज लोकेटेड इन विच स्टेट? इंदिरा गांधी सुपर थर्मल, राजस्थान, हरियाणा, पंजाब और उत्तर प्रदेश। हम्म, इंदिरा गांधी सुपर थर्मल पावर प्रोजेक्ट इज लोकेटेड इन विच स्टेट? राजस्थान, हरियाणा, पंजाब और उत्तर प्रदेश। उत्तर प्रदेश। विच इज इट? दैट्स योर हरियाणा गाइस। ओके, चलो, due to which of the process in plants the radiocarbon dating is possible to estimate their age? Okay, due to which process in plants the radiocarbon dating is possible due to estimate their age? Hmm. Growth, chemosynthesis, photosynthesis, or assimilation? Assimilation. Do plants do assimilation? No, they don't do. Right? What's the answer? What's the answer? That's your photosynthesis, guys. Okay. Chalo. Now, which solution makes a cell turgid? Turgid, turgid, turgid means hmm, makes, which solution makes a cell turgid? Turgid means swelled, right? Turgid means swelled. So, which one is it? Hypotonic, isotonic, hypertonic, or none of the above? That's your hypotonic only, right? Chalo. Which among the following players of India was famous as Pocket Dynamo? Pocket Dynamo, Leander Pace, Vijender Singh, KD Jadhav, or Gurbooks Singh? Hmm. केदार जाधव, केदार जाधव है ना? Okay. Which of the following players of India was famous as Pocket Dynamo? Leander Pace has a correlation with the tennis, if you remember. Tennis. Vijender Singh has a correlation with the boxing. KD Jadhav and Gurbooks Singh. That's your C. KD Jadhav. Right. Very good. Individual Olympic medalist. He won the wrestling bronze medal at the Helsinki Games. Helsinki Games. Term gambit. Okay, man, I would have spell it around Gambhir. Gambit is associated with which of the following sport? Gambit. Okay, basketball, chess, golf, or boxing. Simple hai. That is simple. If you would have played that sport, then that is much familiar with you. Which one is it? Basketball, chess, golf, or boxing? Gambit. Chalo, anyone? That is B, right? Chess. Which institution is set to hold a hearing on religious freedom in India? Religious freedom in India. USCIRF, National Archives and Records Administration, ICCR or Niti Aayog? That's going to be your USCIRF. Okay. Chalo. Now, which country delayed the ban on new petrol and diesel cars? Delayed the ban on new petrol and diesel cars. USA, UK, Canada, or Russia? Russia. 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 फ्लूमा जनरल हर्षिनी यादव अभी याद आ रही है फ्लूमा जनरल की, बहुत दिनों के बाद याद आई फ्लूमा जनरल की, हमने तो बहुत पहले क्वेश्चन किया था। ओके ओके, सो यू वुड हैव सीन दिस वन एट थोड़ा पीछे. This one, that's your UK guys. Okay, new petrol and diesel cars, that's your UK. Choose the drug which inhibits sodium potassium 2 chloride co-transporter. सिंपल, लेकिन वो ड्रग कहाँ है? हाँ है तो ठीक है. Which one is it? Which one is it, guys? Choose the drug which inhibits sodium potassium 2 chloride co-transporter. Spironolactone, mannitol, or acetazolamide. Which one is it? Anyone? Sodium potassium 2 transporter that is present in your ascending loop of Henle. Ascending loop of Henle, and that is what? Bumetanide. Bumetanide, right? निधि कनाडा से यूरेनियम के लिए भी है. क्या कहना क्या चाह रहे हो विकास कुमार? That's your bumetanide. Spironolactone is your what? Potassium sparing diuretics. Potassium sparing diuretic, right? Mannitol, osmotic diuretic. Osmotic diuretic. Acetazolamide, carbonic anhydrase inhibitors. Bumetanide, torsemide, है ना? Furosemide. That is what? Sodium potassium 2 chloride transporter, right? Chalo. Shortest acting competitive neuromuscular blocking agent is T-tuberculin, mevacurium, pipocurium, or pancuronium. Simple. Competitive neuromuscular blocking agent. Neuromuscular blocking agent, that's your NM receptor. NM receptor. I'm asking. NM receptor blocker. NM receptor blocker. T-tuberculin, mevacurium, pipocurium, or pancuronium. Which one is it, guys? Which one is it? T-tubercularium, competitive, but it's not short acting. Mevacurium, pipecurium, pancurium, these are the long acting drug. Long acting drug. Mevacurium is the shortest acting drug, right? Shortest acting drug. Simple. Now, leukotriene antagonist used for the bronchial asthma as is okay. Receptor antagonist. Zafirlukast, xyluten, cromolyn, sodium, aminophylline. Okay. Xyluten is what? Xyluten is your 5-LOX inhibitor. Hana? Cromolyn sodium is your what? Cromolyn sodium is going to be your mast cell stabilizer. Aminophylline is your PDE inhibitor. Hana? Particularly which PDE inhibitor, guys? Zafirlukast is going to be the correct answer. सर कनाडा से यूरेनियम के लिए सरकार 10 साल के लिए मंजूरी दी है. अच्छा ठीक भाई साहब, थैंक यू. Zafirlukast is going to be the leukotriene antagonist receptor, है ना? Receptor antagonist, Zafirlukast and Montelukast. So can anyone tell me what is the adverse drug reaction of the Zafirlukast and Montelukast? Can anyone tell me what's the adverse effect of Zafirlukast and Montelukast? Anyone? Anyone is there? Yep. Anyone? No one. Churg-Strauss syndrome. Churg-Strauss syndrome is going to be the syndrome that is occurred when Zafirlukast or the Montelukast is being given. Okay, chalo. Now, sodium nitroprusside acts by activation of guanylyl cyclase, potassium channels, calcium channels, or cyclic AMP. Simple as that. Sodium nitroprusside is being given in which condition? In which condition we do give? In which condition? In which condition we do give the sodium nitroprusside? Anyone? Anyone, guys? Guanylyl cyclase, potassium channels, calcium channels, or cyclic AMP? Yeah, simple, very simple question. Very simple question. Angina. Okay. And it is a DOC for drug of choice for. It is a drug of choice for. It is the drug of choice for which condition? That is going to be your guanyl cyclase, guys. CGMP level is going to be increases, and hence the nitric oxide releases when EDRF in the endothelium dependent relaxing factor takes place, right? Nitric oxide releases. So dilation takes place. But at which condition it is known to be as the drug of choice? That's what I am asking. Sodium nitroprusside has been given into the emergency hypertensive, right? Emergency hypertension. May it is given IV. It is given IV, right? And what it may cause? It may cause the nitrate poisoning. It may cause the nitrate poisoning, right? And methemoglobinemia, right? Methemoglobinemia by by inhibiting the which chain? अरे यार, mitochondrial chain, electron transport chain, yeah, by inhibiting the electron transport chain, right? Methemoglobinemia. And which drug is being used as an antidote of nitrate poisoning, guys? Antihypertensive, yeah, that's you have said, but is the drug of choice that was asking, Ayush Raj? Drug of choice is emergency hypertension, not single hypertension, right? Which drug is being used into the nitrate poisoning? That's what I'm asking. Drug of choice for nitrate poisoning. Anyone? Anyone, guys? Drug of choice for nitrate poisoning? Yeah? Anyone? Chalo. Which one is correct option about the half-life of carbimazole? 2 hours, 8 hours, 16 hours, or 24 hours? 2 hours, 8 hours, 16 hours, 24 hours. That's your 8 hours, guys. Okay, carbimazole. Chalo. Oxytocin causes all except lactogenesis. Organophosphates? No. No, 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 no. Organophosphates are not. Sodium thiosulfate. Sodium thiosulfate. Amyl nitrate. Amyl nitrate. These are being useful for the nitrate, not, you can say cyanide poisoning to be precise. Cyanide poisoning, not nitrate poisoning. Cyanide poisoning. Okay. Chalo. Now this one, oxytocin causes all. Lactogenesis, milk ejection, yes. Contraction of uterine muscle, yes. Myoepithelial cell contraction, yes. Hana. Lactogenesis is usually done with, okay, which hormone is responsible for the lactogenesis, guys? Can anyone tell me? Junior vlogs. Nidhipal says B, Vikas Kumar says B, Varun Dhawan says B, अंकुश भारद्वाज एक सिंगर का नाम है, अंकुश पंगोत्रा says A. Okay, so lactogenesis is not the correct answer. Lactogenesis is happened with which hormone? That's what I'm asking to you guys. Hana, which one is it? Oxytocin causes all except lactogenesis, milk ejection, contraction of uterine muscle, myoepithelial cell contraction. Which one is it? Prolactin. Very good. Prolactin, that has been responsible for the lactogenesis. That's your milk production. Okay, cyanide poisoning में विटामिन B12 भी है ना सर? हाँ, obviously विटामिन B12 भी देते हैं, विटामिन B12 भी देते हैं, है ना? Prolactin. Now prolactin is responsible for the genesis. That's your milk production. But contraction of the uterine muscle, और अगर हम contraction myoepithelial cells की भी बात करें, है ना, तो उसका भी contraction leads towards the oxytocin only. Ejection, obviously contraction takes place, तो oxytocin, sorry, ejection मतलब contraction of the myoepithelial takes place, that will leads to the ejection as well, right? है ना? That is what the oxidation 2. Now I'm asking that prolactin has been released from which gland? Which gland? Which gland, guys? Leukotropic hormone. Very good, Nanu. Supeker. Now, which one is it? Anyone? Anyone? Which gland? Prolactin has been released from which gland? No one? Anterior pituitary, बच्चे. Anterior pituitary only, right? Anterior pituitary. And if you remember about the dopamine is inversely proportional to the prolactin. If dopamine levels gets high, the prolactin level gets down, right? Pituitary, anterior pituitary. Chalo. Now, which one is correct about the ticlopidine? Ticlopidine, decreasing ADP mediated CAMP activation, inhibiting COX enzyme irreversibly, GP2B3A antagonist phosphodiesterase inhibition. Which one is it? Ticlopidine. Ticlopidine is your what? Anti-platelet drug. You know that, Anna? Anti-platelet drug. You know that. So that is going to do what? That is going to do what? ATP mediated CMP activation, COX enzyme irreversibly, GP2B3A antagonist, phosphodiesterase 3 inhibition. That's your that is this one. Decreasing ADP mediated CAMP activation. Guys, don't. P2Y2, P2Y2 ticlopidine, P2Y12. क्या कर रहे हो तुम लोग? What's going on? चलो. This one now. The following statement is incorrect regarding gray baby syndrome. Okay, so everybody knows about the gray baby syndrome. Now, can anyone tell me who causes the blue baby syndrome? What causes the blue baby syndrome? And what causes the red man syndrome? And what causes the Loeffler syndrome? That's what I'm asking. Chalo, red man syndrome, blue baby syndrome, or Loeffler syndrome? Tell me first this one. It is characterized by hypertonia and hyperthermia in child. It is due to deficient conjugation of liver in neonates. ये ठीक है. Incorrect पूछा है. Okay. Due to inhibition of the electron transport. ठीक है. Manifestation upper within 1.5 week. ठीक है. Vancomycin red man. Amiodarone is blue baby syndrome. Very good. Vancomycin red man. Loeffler syndrome. That is going to be A. Very good. Red man is vancomycin. Very good. Very good. Very good. Nitrofurantoin. Loeffler. Very good. Very good. Very good. Fluoroquinolone doesn't do anything. Fluoroquinolone do the tendinitis, if you remember. Tendinitis they do only, right? Chalo. Administration of antacid reduces action of which of the following anti-ulcer agent? Okay. So, sucralfate is your answer to be precise. And sucralfate is your what? Polymerizes. It polymerizes the gastric membrane, right? Gastric membrane, right? And what happens after that? Sucralfate only uh, shows the action when pH is around less than 3 or 4, right? 4, right? It needs the acidic medium. That's right, Deepak Kumar. And pH should be the थोड़ा सा उल्टा बना दिया मैंने. हाँ, pH should be less than 4, right? Should be less than 4, then only. And now if you can see antacid, you'll be giving the antacids, right? So antacid reduces the pH, it neutralizes towards the one, है. So that reduces the sucralfate actions, right? Chalo. Drug containing two sulfonyl groups in a molecule is BAL, EDTA, penicillamine, none of the above. Chalo. B. Naresh Kumar. Okay, now this one. Drug containing two sulfonyl groups in a molecule is BAL, EDTA, penicillamine, and none of the above. Which one is it? Which one is it, guys? Which one is it? That's going to be a BAL and British anti-leucide. So British anti-leucide it is used into the which poisoning? Which poisoning? It is also known as the dimer caprol. किसकी poisoning में बाल यूज करते हैं? ब्रिटिश एंटी ल्यूसाइड. बताओ. Cholinomimetics are useful in all of the following conditions except glaucoma, myasthenia gravis, postoperative atony of bladder, partial heart block. किसमें cholinomimetics use करेंगे? So cholinomimetics is obviously going to increase the acetylcholine levels, right? So glaucoma, yes, it should be because myotics are very much useful in glaucoma. Myasthenia gravis, yes, they do increase the contraction of muscles. Yes, they do. Postoperative atony of bladder, yes, they do increases the you can say they decreases the urinary retention and they increase the urinary excretion. Partial heart block, obviously the heart block is over there, means the heart rate is obviously down, and you know that acetylcholine is going to decrease down the heart rate. So D is going to be the correct answer, right? Chalo. Mechanism of action of colchicine. Okay, yesterday we have seen this question. Chalo again. Mechanism of action of the colchicine in acute gout. Prevent of the granulocyte migration, inhibition of the leukotriene synthesis, inhibition of uric acid formation, inhibition of purine metabolism. चलो बताओ, which one is it used? Mechanism of action of colchicine in acute gout. Prevention of granulocyte migration. Yeah, that is going to be the correct answer. Hana? Prevention of granulocyte migration, that is going to be your correct answer, right? Very good. Chalo. Which of the following is a common side effect of the colchicine? Diarrhea, constipation, dysentery, or flatulence? Which one is right? Which one is it? That is your diarrhea. Very good, very good, very good. Cough syrup mostly contains of the following: dextromethorphan, noscapine, ephedrine, or codeine. Cough syrup. Sorry. Cough syrup mostly contains of the one of the following: dextromethorphan, NMDA, antagonist. Noscapine is your non-opioids. Okay, remember this one. Noscapine, no. That's your non-opioids. Codeine, opioids. Ephedrine, mixed acting drug. Mixed acting sympathomimetic. Okay. Chalo, this one, that is going to be your dextromethorphan. Now, can anyone tell me the other drugs which acting as an NMDA antagonist? Anyone? Any other drugs as well which is acting onto the NMDA antagonist? As a NMDA antagonist. Anyone? And dextromethorphan, that has been used in your dry cough to be precise, right? Antitussives. Right? Antitussives. Chalo. Amantadine is an NMDA antagonist. Amantadine. Okay. Dopamine facilitator, NMDA antagonist. Okay. And blue baby element nitrite. Ketamine, yes, very good. Ketamine is also a NMDA antagonist. Memantine is also an NMDA antagonist, right? Chalo. Okay, कहाँ जा रहा हूँ मैं? Where am I going? Antibiotics inhibiting the bacterial cell wall synthesis. Bacterial cell wall synthesis firmly bind to cell wall. Firmly bind to cell wall. V, right? F for phosphomycin. B for beta lactams, as well as the bacitracin, right? T for tyrothricin. C for cyclosporin, and V for vancomycin. So beta-lactam antibiotics is going to be the correct answer, right? Chalo. Now, which drug is considered to be most potent diuretics? Most potent diuretics. Loop diuretic, thiazide diuretics, potassium sparing diuretic, carbonic anhydrase inhibitors. Chalo, tell me. Now here you can expect one more question, that which drug of choice, which of the diuretic, which diuretic is drug of choice for renal failure. Okay. So which diuretic is known to be as adverse effect hypersensitivity reaction? Very good. Very good. That's your 𝘎𝙬𝙎 reaction, if you remember. Hai na? When you give the penicillin in the sexually transmitted disease that is known to be as the gonorrhea, hai na? Then you will be seeing the 𝘎𝙬𝙎 reaction over there. Hai na? That is also been considered for cephalosporins as well. Now this one, loop diuretics, very good. Loop diuretics are being useful for that. Now if I ask this one, diuretic is the drug of choice for renal failure. Which diuretic is drug of choice for renal failure, and which diuretic should be given into pulmonary edema? Pulmonary edema mein which drug should be given? As well as the cerebral edema, if I talk about cerebral edema, then pulmonary edema, cerebral edema, then anyone? Pulmonary edema में mannitol should be given, right? Mannitol should be given. Cerebral edema में furosemide should be given, right? Furosemide should be given. चलो, diuretic of drug of choice में renal failure में भी loop diuretics is the answer, right? चलो, first line drug for COPD, methylxanthines, short acting bronchodilators, corticosteroids, or none of these? Methylxanthines, short acting bronchodilators, corticosteroids, or none of these? Okay. Mannitol cerebral. That's right. So sorry guys. That was wrong by me. Ana कि mannitol, do correct. Cerebral has been useful in the cerebral edema. Mannitol is useful in cerebral edema. And if I talk about the furosemide, pardon me, Deepak Kumar, pardon me. Furosemide has been useful in your pulmonary edema. Okay, chalo. Now this one, first line treatment of COPD, chronic obstructive pulmonary disease, methylxanthine, short-acting bronchodilator, corticosteroid, none of these. That's your short-acting bronchodilators. Can anyone tell me what are the examples of short-acting bronchodilators? What are the examples of short-acting bronchodilators, guys? Examples? हो जाती है गलती कभी-कभी, है ना? Salbutamol, terbutaline. Very good. Which of the following is not a selective serotonin reuptake inhibitor? Not a selective serotonin reuptake inhibitor. That's your SSRI. नहीं है. Escitalopram, sertraline, paroxetine और amitriptyline. Simple है. Simple. That is going to be your amitriptyline, है ना? Amitriptyline is your TCA. So it is not a selective serotonin reuptake inhibitor, right? Chalo. Which of these joints do not show any movement? Fibrous, synovial, pivot, or cartilaginous? Which one is it? Anyone, guys? Which of these joints do not show any movement? Fibrous joint, synovial joint, pivot joint, or cartilaginous joint? Fibrous joint do not show any movement. You can find it on your skull, right? Skull may they are being used. Okay, not used, they are present over there. That's your known to be as the suture. Very good, Deepak Kumar. Chuchud. Chalo. The trigone is an area located within the urethra, urinary bladder, renal, pelvis area, or kidney. Which one is it? Trigone is an area located within the urethra, urinary bladder, renal pelvis area, or kidneys. Which one is it? Urinary bladder. Very good. Urinary bladder. Here you can see, that's your detrusor muscle. This part is the detrusor muscle, and this is what your sphincter it is. Sphincter it is, right? Detrusor in, you can say, in parasympathetic condition. In parasympathetic condition, urine increases, right? Urine increases, right? And if urine increases, then this should be relaxed. Sphincter should be relaxed, right? Sphincter should be relaxed, and the upper part, detrusor, is contracted, contracts in the parasympathetic condition. And if you see the sympathetic condition, what will happen? Sympathetic condition में reversed, है ना? Sympathetic condition में urine outflow will be decreased, है ना? शेर को देख करके you will not be try to pee, no, है ना? You should be running at that time, right? So sympathetic condition में urine is down, so urine is down, the sphincter is closed. Sphincter is just like the tap, है ना? Sphincter is just like the tap. If you open the tap, urine will outflow. Tap close, then urine will not flow. So sphincter should be contracted at that time, right? And the and the ulta thing, detrusor will be relaxed. Okay, this is the thing. And this question was asked into the RRB 2024 last year wala. In parasympathetic condition, they have asked this question. So have this in your mind. Now, congenital diseases are diseases present after birth, from birth, diseases spread from one individual to another, diseases that occurring during the lifetime. Chalo, which one? नरेश, मैंने देखा था 400 ml के लगभग पड़ा था यार. 200-250 ml से ज़्यादा टाइम यूरिन होगा तो यूरिन आएगा, मतलब 200-250 ml से ज़्यादा यूरिन होगा तो यूरिन आएगा. क्या बात कर रहे हो? That is your present from birth, okay? Chalo. Usual the time of diagnosis in which stage occur of diseases. Acha, diagnosis. Usual the time of diagnosis in which state occur of disease. Stage of susceptibility, clinical disease, subclinical disease, और stage of recovery. फिर से देखता हूँ. क्या देख रहे हो भाई? हमें बताओ. चलो, this one. That's your stage of clinical diseases, right? Chalo. Father of medicine, universally known to be as the father of medicine, Hippocrates, Aristotle, Dioscorides, or Theophrastus. Which one is it? Hmm. Anyone? Anyone? बच्चा बच्चा नोज. बच्चा बच्चा नोज. हिपोक्रेट्स, राइट? सर, कितना ml यूरिन स्टोर होने के बाद यूरिनेशन लगता है? अच्छा, चलो. To distinguish wool from silk, when lead acetate is added to a solution of wool in caustic soda, which is formed? Red color is formed, blue fluorescence is appear, black precipitate is formed, violet color formed on the surface. Which one is it? Yeah. Pharmacognosy father, Dioscoride. Acha, who is the father of pharmacology? That is going to be black precipitate, right? Who is the father of pharmacology? Modern pharmacology? Anyone? Punarva side is an active constituent. GPAT answer key is not released. It is released, but it has taken back. I don't know what is the reason behind it, and it will be released again tomorrow at 3 p.m. Shiv Durga, Vijayalakshmi. Punarva side is an active constituent found in Shankhini, hogweed, Phyllanthus or Shankhini, hogweed, Phyllanthus or Eclipta. Hmm. ML Shroff, Indian pharmacology. ML Shroff, nahi? No. Ramnath Chopra was the father of Indian pharmacology. Naresh. ML Shroff is the father of Indian education. That's a hogweed, guys, okay? Chalo. Stomata found in senna leaf. Parasitic, diacytic, anisocytic, or anomocytic. Which one is it? Senna leaves. Senna and coca are parallel with ruby. Right? Parallel to parasitic, right? Chopra, RN Chopra. Very good. Chalo. Mice are used to test rabies vaccine are the evaluation comes under. Chemical evaluation, biological evaluation, physical evaluation, or organoleptic. अरे भाई चलो tell me. Yeah, that is going to be your that is going to be your which one? Simple. Chemical evaluation. Mice are being used बच्चे. Deepak Kumar, Nadeem, Sheikh. Mice are being used. Mice are being used. So mice is what? Living thing, no? So biological evaluation, right? Chalo. During the extraction of alkaloid in plant, the material is treated with petroleum ether or hexane 2. Which one is it? Which one is it? Hmm. Which one is it, guys? Yeah, that's your to remove the fatty substances. Okay. Tukka nahi marna bide. 0.3 and negative marking, Naresh. The chemical behavior of alkaloid is basic, acidic, amphoteric, or neutral. Simple. Very simple. Very simple. Very simple. Yeah. Basic. Right? Very good. Chalo. Which of the following is the key feature of the taxonomical classification? It classifies the drugs on the basis of chemical constituents. It provides the information regarding therapeutic uses of crude drugs. Phyla, order, family, genera, species. Yes, obviously that's going to be the correct answer, right? C is going to be the correct answer. If A, B, and C is 2:3:4, then A divided by B, B divided by C, C divided by A, what should be the answer? So A is 2, B is 3, and C is 4, right? So A is 2. The 2 divided by 3, 3 divided by 4, and 4 divided by 2, right? This is going to be the correct answer. है ना? तो क्या होगा आंसर इसका? What should be the ratio then? What should be the ratio then? Hmm? What should be the ratio then? Right? If A, B, C is 2, 3, 4, A, B, B, C, and C, A, then what should be the answer then? Anyone? That is going to be 894. Okay, 894. 24 is going to be a correct answer. Okay, what is the remainder when this much is divided by 1000? Divided by 1000. 0. क्या बात है? Answer is 0. चलो. If in a triangle ABC, if three sides are A, B, 7, then find angle B. Then find angle B. ABC is equal to A is equal to 5, B is equal to 7, C is equal to 3, then find angle B. Which one is correct? That is going to be 120 degree. Okay, तो cos क्या बात है, trigonometric लगा डाली यहाँ पे हमने तो. Okay, fine. चलो, find the opposite to 3. Find the opposite to 3. इसका तो तुक्का लगा लो, है ना? You can guess it now. Hmm. Anyone? Find the opposite to 3. 3 के बाद में उल्टा क्या आएगा? That is 4, right? 4 is going to be the correct answer. Okay. चलो, now this one. All harmonium. अच्छा, ये syllogism से आ गया question. Syllogism से आ गया. Okay. All the harmoniums are the instrument. All the harmoniums are instruments. All instruments are flutes. Okay. All the harmoniums are instrument. So all the harmoniums are instrument. Harmonium are instrument. तो instrument ये आ गए HI, right? And all instrument are flutes. तो all instruments are flute. ये हो गया भाई. ठीक है, इसको दोबारा से बना लेते हैं अच्छे से, है ना? If you make it this one, right? So this is your harmonium, and this is your what? The instrument, है ना? And all instruments are flutes. तो all instruments are flutes. Then ये हो गया, है ना? तो now all flutes are instrument or flutes are instrument. All flutes are instruments. That is going to write or not? Flute instrument. How? No. All harmonium are flutes. All harmonium are flutes. All harmonium are flutes. That is going to be the correct answer, right? 2. Okay. Chalo. Now select the Venn diagram that represents relationship between the given groups. Father, children or male. Father, children और male. तो मेल क्या होंगे? फादर भी हो सकता है, चिल्ड्रन भी हो सकता है, राइट? सो मेल शुड बी लाइक दिस वन, है ना? एम मेल में फादर आ जाएंगे. चिल्ड्रन, चिल्ड्रन कैन बी मेल और कैन नॉट बी मेल. सो समथिंग लाइक दैट, है ना? चिल्ड्रन मेल कैन नॉट बी मेल, right? So this is going to be, C, right? Very good. Yep. P is the brother of Q and R. P is the brother of Q and R. P is the brother of Q and R. Okay, Q and R का brother है, bro, right? Bro. S is R's mother. S is R mother. ये mother है, right? T is P's father. T is P's father. P जो है वो P का father है, है ना? Father. That's a P is father. Then which of the following statement is definitely cannot be definitely true. Okay, so T and S are क्या हो गए? These are your parents, right? So P is the brother, so ये भी, this is not confirmed कि this is she or he, right? This is not confirmed, and this is also not confirmed that he is she or she, right? तो T is Q's father, T is Q's father, ये इसका भाई, भाई का भाई, mother and father, yeah, that is right, that is right, है ना? S is P's mother, S is P's mother, that is also right, कि P is bro of this one, so bro same, so mother, that's right. P is S son, P is S son, that is also right, है ना? mother है, ये उसका लड़का, है ना? that is going to be the son. तो Q is T's son, Q is T's son, that is not confirmed, right? That is not confirmed, that is not confirmed, right? So Q is T's son, that is not confirmed, so D is correct answer, right? Here you can see Q, gender is not mentioned, Q may be son or daughter, that's why Q is correct option, right? Chalo. Okay, my battery is getting low, wait a minute guys. Chalo. Now, which of the following is mostly used liquefied gas in aerosol? Which of the following is mostly used liquefied gas in aerosol? Propane, chlorofluorocarbons, ethane, or carbon monoxide? Which are being used mostly? Which are being used mostly? Which one? That's your CFC. Very good. Anna? CFC. Chemical name of span 85. Sparmsesquioleate, sorbitan isostearate, sorbitan monooleate, sorbitan trioleate. Which one is it? Span 85, guys. Span 85, sorbitan sesquioleate, sorbitan isostearate, sorbitan monooleate, sorbitan trioleate. Anyone? That is going to be sorbitan trioleate. Okay. Chalo. Sulfur is added in the manufacture of rubber closer as. Simple. Bacha knows this one. Vulcanizing agent, antioxidant, accelerator, or pigment. Which one is being used? Hmm. Yeah. That is going to be your A vulcanizing agent, right? Chalo. This table is also very much important, by the way. Activator, stearic acid, and zinc oxide, which is already asked, right? Okay. Accelerator, mercapto, benzothiazole. That has been already asked. Which of the following compound is provided in the powder of preparation of baby powder? Boric acid, zinc stearate, cetyl or sterile alcohol, only boric acid, or undesylante? Undesylante. Which one is it? Preparation of baby powder. Hmm. That is going to be your only boric acid, right? Coating used to protect the tablet from acidic environment of stomach. Which coating? Film coating, sugar coating, enteric coating, or encapsulation? Chalo, simple. That is going to be your enteric coating, right? Chalo, Maillard reaction. Maillard reaction is related to lactose, if you remember, lactose, and that is what relation with the primary amine, Maillard reaction, diluent, binder, glidant, or disintegrant. That is your diluent, right? Chalo. Here you can see Maillard reaction, furaldehyde due to formation of furaldehyde, right? Chalo. What do you mean by filter cake? The cake which is to be filtered. A porous membrane used to retain the solids which are present under the filter, or a suspension to be filtered. Simple. Isoniazid. Very good. Isoniazid के साथ में होता है डॉट्स 1997. Very good, Naresh Kumar. Good going. Good going. चलो. This one. This one, guys. Filter cake. Yeah. Filter cake. That is your C. Okay. So the Brownian movement of particle is suspension cause. Assist sedimentation, promote sedimentation, prevent sedimentation, increase the sedimentation. Brownian motion is what? पहले तो ये बताओ कि it is a optical property or kinetic property or kinetic property. Which one is it? पहले तो tell me this one. Is it a optical property or kinetic property? Hmm. Which one is it? That's going to be prevent sedimentation. That's right. That's right. Prevent sedimentation. That's right. But is it a optical or kinetic? That's what I'm asking. That's a kinetic. Very good, Ankush Pangotra. Very good. Chalo. Calculate the HLB of polyoxyethylene monostearate 180 for which S is 47.5 and 120 is A. So HLB is equal to 21 minus S upon A. This is the formula, I think, right? 21 minus S is 47.5 and A is 190. Okay, that is थोड़ा सा calculator की हमें ज़रूरत पड़ेगी. That is going to be 15. Okay, and here you can see 21 minus S upon A, right? 47.5 upon 195, 190, and HLB is going to be 15, right? So if the HLB is going to be 15, then it is in the range of which thing? It is in the range of which thing, guys? है ना? Which thing? Wetting agents, detergents, solubilizing agents, anti-foaming agents. Which agents? Which one is it? If the HLB is around 15, then which one is it? Is it a wetting agent, detergent eating, solubilizing agent, or anti-foaming agent? Chalo, tell me. Come on, fast. Come on, come on, come on, come on. Detergent? No. No, 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 no. That is yours. Solubilizing agent, बच्चे. Solubilizing agent. हाँ मतलब solubilizing agent तो हम कह सकते हैं 16 to 19, but yeah, detergents could be at 12 to 16. Yeah, that's right. हाँ, detergents would be the correct answer. That's right. Detergent. Very good. Detergent. The sterile product cannot be obtained one of the following mills. Okay. The sterile product cannot be obtained by one of the following mills: colloidal mill, cutter mill, fluid energy mill, or ball mill. Sugar mill, paper mill, beta tu mahar mill. चलो. Colloidal mill, cutter mill, fluid energy mill, or ball mill. Which one is it? Very good, Naresh. Very good. The sterile product cannot be obtained from the cutter mill, है ना? Cutter mill तो ऐसी तैसी हो जाएगी उससे. Now, which of the following sequence is involved in the mechanism of size reduction? Cracks and flaws, flaws and cleavage, cleavage, flaws and cracks, flaws, cracks, and then cleavage. Simple. Chronology समझाइए आप. Tell me the chronology. Chronology. Chronology, guys. Chronology. Which of the following sequences is involved in the mechanism of size reduction? Cracks, flaws, flaws and cleavage, cleavage, flaws, class. Bang, Poonam. क्या बात है? Poonam. That's going to be D, right? Chalo. Advantages of multiple dose study can be elicited as multiple dose studies. Predict terminal half life. Terminal half life का multiple dose से क्या लेना देना? Blood levels can't be measured at same concentration. Predict peak and valley characteristics of drug. Non-linearity of pharmacokinetics cannot be determined. Chalo. That is going to be predict the peak and valley characteristic of drug. Okay. The volume of blood that flows per unit time per unit of the tissue is called. Chalo, simple. Very simple. Very simple, guys. Very simple. Hmm. That is your perfusion rate. Naresh Kumar. Perfusion rate, okay? Chalo. Which of the following surfactant are mostly used as a principal surfactant because of their superior foaming properties and low cost? Which one is it? Non-ionic, cationic, anionic, or amphoteric? Chalo, can you give me some examples of this one? Non-ionic ka example, cationic ka example, anionic ka examples, amphoteric ka examples. Anyone? Anyone? Examples. Anyone, guys? Non-ionic, cationic, anionic, or amphoteric? Highest perfusion in lungs. Very good, Naresh Kumar. That is your lungs. Anionic is going to be the correct answer. Very good. Trushali Patel. Okay. That's nice. That's correct answer. That is correct answer. But what is the example of non-ionic, cationic, anionic, amphoteric? Can anyone tell me? Can anyone tell me that? Uh, Anionic SLS. So non-ionic spans and twins. Very good. Sulfate, anionic, negative charge. Okay, very good. Chalo. Okay, now select the sequence in gram staining. Primary stain, counter stain, decolorization, mordant. Primary stain, mordant, decolorization, counter stain. Primary stain, counter stain, mordant, decolorizer. Primary stain, decolorizer, mordant, or counter stain. Which one is it? Soaps, and bridge. That's right. Cationic, positive number wale. Very good. Niyam wale. Yes. Chalo. Which one is it? Correct sequence in the gram staining. Gram staining. That's your B. Very good. Bacteria have clusters of flagella at both poles of cells are known as clusters of flagella. That's your amphitrichosis. Trichos. The fragments of DNA attached to an RNA initiator component was discovered by Watson and Crick, Okazaki, Peterson, or Nelson. Nelson Mandela. Yeah. Anyone? That's your Okazaki. Right? So one of the following is not a fixed shop, large scale retailer. Not a fixed shop, large scale retailer. Mail order business, hire purchase shops, cooperative stores, or specialty shops. That's going to be your specialty shops, guys. The main object of the Poison Act. Poison Acts comes in which year? Which year, guys? Which year? Poison Acts comes in which year? Came in which year? Hmm? To achieve adequate supply, to achieve equitable distribution, to import and poison, to regulate and control import, possession and sale of poison. That is going to be D, right? Very good, very good. D is going to be the correct answer. 1919, 19 साल का लड़का पॉइजन पी लिया था 19 साल का लड़का पॉइजन पी लिया था. Very good. 1970 नहीं, 1970 was Patent Act. Ankush. 1970 was Patent Act. And 1971 is your MTP Act. चलो, coca, opium and hemp comes under Dangerous Act, Poison Act, Drugs and Cosmetic Act. None of the above. चलो, simple. 3rd September 1919. Very good, very good, very good, Naresh Kumar. चलो. Yep. Coca, opium and Coca-Cola too. Tony Kakkad. Dangerous Act, right? Patent Office, Kolkata. Very good. That's going to be your A, right? Chalo. What does the Schedule J contain? Pack size of drugs, disease which contain may not purport, prevent or cure, list of prescription drugs, list of permitted dry colors in cosmetic. पहले तो ये बताओ. Pack size of drugs comes under schedule P, right? P1 to be precise, right? Disease which may not drug to prevent or cure. List of prescription drugs. Prescription drugs. That is right. List of prescription drugs that I would ask him. Permitted dye colors in cosmetics. Anyone? Anyone? Prescription drugs. Prescription drugs. Prescription drug is H. List of permanent color, that is Q, right? Chalo. Yeah, life period was P and P1 is the pack size, right? Chalo. The schedule to which list of drugs to be sold on prescription only belongs to. Simple. Now, just we have done. Just we have done. Just we have done. Just we have done, guys. Hmm. That's your schedule H. Very good, very good, very good, very good. Which of the following software is used in the drug information? Okay, Medline, Medlar, TDB. Which one? All of the above, right? All of the above are being used. Chalo, very good. Now, pharmacist is the link between doctor and nurse, medical profession and public, medical practitioner and pharmaceutical industry, medical practitioner and medical profession. Chalo. If you would not able to answer this one, then you are not a pharmacist. G is supervision, Y is clinical trial, X is narcotic. Very good. Mm. Yeah, that is B, medical profession and public. Very good. Now here it comes. Here it comes again. Same question was I asked before. Another same question that I asked before. Medical Termination of Pregnancy MTP Act was passed in 1956, 1971, 1983, or 1969. Simple, simple, simple is that. Simple as that. Simple as that. Hmm. Simple. That's your 1971, right? 1971. मैं फिर आ गया पर मेरे जाने का टाइम हो गया दीपक कुमार. Okay, because this was the last question. Thank you so much. And that's it from my end, guys. Do well today, tomorrow. Sorry. Do well tomorrow and do make yourself proud and let the thing happens. Whatever happens, that happens for a reason. And just thus trust the process, what you have gone through, and trust the journey as well. Right? You will be definitely going onto the in a competition world, right? And hopefully, and I wish as well that for your selection in your RRB pharmacist exam, right? And best of luck. And if you want to connect with me, this is my Anna. So this is what my is. So if anyone wants to connect with me and if anyone wants to ask something, any guidance, whatever you want to, Anna, so you can connect with me. And yes, at the end, thank you so much for joining me. And it feels very grateful to have you guys, Hannah, to have you guys in this session from last 3 days. And that is what I believe you will definitely going into the good direction and you will definitely cross that damn line. Okay, that damn line of the RRB pharmacist. Okay, so if anyone wants to connect with me, you can connect, and but do not call because I will be very busy. So you can just text me over there. WhatsApp पे text कर सकते हो. You can text me on the website, WhatsApp, and that's it. Okay. Thank you so much, guys. If you are satisfied, give me a heart. If you are satisfied, give me a heart. Put the heart into the comment section. परिशाद भी कह सकते हैं आपको, परेशान भी कर सकते हैं. ओके ओके, कर लो भाई, परेशान कर लो, कहाँ ही जाओगे परेशान होके. Give me hearts, guys, if you are satisfied with the questions as well as the efforts of mine, obviously. है ना? Put it down into the comment section. Okay, guys, thank you so much, and do connect with me. I will be looking forward for that. I will be waiting for your messages, hi messages, with your name, so that I can connect with you. Your name, क्या बात है, क्या बात है यार, अंकुश पंगोत्र. चलो, okay again. Bye bye. See you and take care, guys. Okay, don't be in a worry. Everything is written and everything will be in a your favor. Okay. Thank you so much, guys, and see you soon. Signing off.